Sir, you know eating food like that is terrible for your health?
What?
Sir, let me talk to you about coronary heart disease.
Oh,
Well, sir, coronary heart disease is when the coronary arteries become narrowed by a gradual buildup of cholesterol-containing deposits called plaque within the walls. This condition is called atherosclerosis, and the fatty plaque is called atheroma.
what does that do with me? I've been eating what I want, when I want, since I was just a boy.
Actually, coronary heart disease is thought to begin with the damage or injury to the inner layer of the coronary artery, sometimes as early as childhood.
So what? I get my exercise when I make runs to the fridge. And these cigarettes only mess up the lungs.
The damage may be caused by various factors, including smoking, high blood pressure, high cholesterol, diabetes, or insulin resistance, and living a sedentary lifestyle. At the rate you're going, you're on track for one heck of a heart attack.
Oh, that's just a myth. My Uncle Billy Bob was just like me, till one night he up and passed away after an all-you-can-eat cheesecake buffet at the fair. He said it felt like it was a big old mare sitting on his chest.
Well, sir, those are actually all signs and symptoms leading to a heart attack.
But how am I supposed to know if I'm actually having these symptoms?
See, when you're having chest pain or angina, you may feel pressure or tightness in your chest that usually occurs on the middle or left side of the chest. Angina is generally triggered by physical or emotional stress. The pain usually goes away within a few minutes after stopping the stressful activity. In some people, especially women, this pain may be sharp and felt in the neck, arm, or back.
But why can't I breathe right when I walk up the hill to the Dairy Queen?
That's what we call having shortness of breath. This happens when your heart can't pump enough blood to meet your body's oxygen needs after exertion.
So what? That don't sound like no heart attack to me.
Actually, a completely blocked coronary artery from all that junk food may cause a heart attack. Signs of a heart attack include crushing pressure in your chest and pain in your shoulder or arm, sometimes with shortness of breath and sweating.
Well, shoot. How do you suppose I can go and stop myself from ending up like old Billy Bob?
Depending on how willing you are, the best thing for you to do would be to start making better lifestyle choices. This includes things such as quitting smoking, exercising regularly, eating healthier food options. Your primary doctor may also prescribe medications that help lower blood pressure.
I don't know if I'm going to be able to give up my Krispy Kreme donuts.
Then you should know that in extreme cases, surgical intervention can be an option. If necessary, you have a coronary bypass surgery, where a surgeon moves arteries or veins from other areas in your body and uses them to bypass narrowed or blocking coronary arteries.
I ain't never trusted no doctor besides old Doc Wilson. And he only works on my cows.
In that case, there's a non-surgical option called an angioplasty, where a thin, flexible tube with a balloon or other device on the end is threaded through a blood vessel to the narrowed or blocked coronary artery. Once in place, the balloon is inflated to compress the plaque against the wall of the artery, which restores blood flow through the artery. An angioplasty can improve blood flow to your heart and relieve chest pain. A small mesh tube called a stent usually is placed in the artery to help keep it open after the procedure.
I just said I ain't going to trust no doctor, man. Who the heck are you anyway?
Well, sir, I'm just an intern with a heart of gold.
I don't know where that guy gets off. Oh well.